Hey everyone, welcome back to the Wild Health Podcast. We're a genetics-based precision medicine company that's exploring all the big questions around holistic health, wellness, and performance optimization. If you're tired of the traditional healthcare system and want to sign up as a member with us, head over to wildhealth.com. And if you're someone who's looking for a high-touch, all-inclusive concierge medical experience specifically designed for executives and high performers, check out our premium program at wildhealth.com/premium. Now let's get into it.
Dr. Matt Dawson, it's good to sit down with you, man.
Thanks for having me. I'm excited.
Absolutely. So you guys there at Wild Health are taking a pretty wild approach to medicine. Talk to me about what holistic medicine looks like in this day and age, because I heard you say, and this is a quote, genetics alone are almost worthless. So if it isn't just genetics, but that's part of it, what does the whole package look like?
Yeah, I appreciate you starting with that, Tom, because as a genomics-based precision medicine company, everyone thinks that we're super focused on genetics, and we are, but it's just a small part of the picture. So you mentioned holistic medicine, and to me, that's about looking at the entire picture. So genetics, every patient that we see, we sequence their DNA. We think it's critically important. That's like your human operating system, and it's crazy not to have it, but it's only about 20% of your actual health outcome. Everything else you do, your stress levels, what you eat, how you
really
exercise.
fast. How do we get to the 20% number?
Just in general, when they do when they look at studies and try to tease out what are the factors that lead to a certain cause, that's the general number that people quote when they do these regression analysis to see how much of it is due to environment, what you do versus your genetics.
So are you saying, because you would be the first person I've heard say this, so you're saying that we are 80% our lifestyle and only 20% our genetics?
Yeah, 100%. I mean, if you look at the longevity in general, that when you look at these kind of centenarians or super centenarians, there's certainly a genetic component, but when they really try to tease that out, it's about 20 to 30% in all the studies that I've seen. And it seems like other things as well. I mean, we could talk about individual specific markers like ApoE4 and others. Some are very causal, some are not so much. There are some Huntington's disease and things like that that are deterministic, and others play a small role. So when I say 20%, I'm talking about in general your genetics. We're not talking about specific SNPs or mutations, because some can be more or less causative.
Okay, so when you guys are intaking a patient, what is your fantasy? What are the things you want to get to? Obviously, we're looking at their genomics. We now know that that's far less. I thought you were going to say that that's 50%, so it's far less than I thought you would have said. Blood panels, I always tell people, if you gave me one metric to steer by, just give me their blood sugar level. If you let me control somebody for blood sugar, I'm going to take care of basically everything else. So would love to know, like, what's your, and close rank order I think would be useful for people. What does that basket of must knows look like?
Sure. So what I want is as much data as I can get. So the DNA, we look at about 700,000 specific SNPs. With blood work, we do a really big blood panel. Obviously, your insulin sensitivity, your glucose, your A1C, those things are really important. We also need to look at your inflammation. We measure everything that makes you feel and perform a certain way. So your vitamins, minerals, hormones, all of that. Your metabolic fitness, as you mentioned, is really critical. Family history is also really important. We think genetics is kind of the next step, and that's what's going a little deeper, a little better resolution than just your family history, because you can inherit things differently. We look at microbiome as well. We collect an incredible amount of data from wearables. It's literally millions of data points that we can pull. And then we have a conversation, which has kind of been lost in medicine. And we want to get to all the things that we can't measure. Like, what do you eat? Who do you eat with? How do you sleep? All of these things are a little harder to measure. But really, as much data as we can get, and then we combine all that to come up with, hey, here are your risk factors. Here are the things to look out for. Here's where we have the most room to optimize you. But it's literally as much data as we can get our hands on.
Okay, very interesting. And I did pick up in things I've heard you say that what I'll call around to the sort of spiritual side is part of the equation. If we have time, that'll be interesting to get to, but let's zoom in. One, I'd love to know more about, like, what are the, out of the 700K SNPs, and I know you guys are using AI, and that's definitely a big part of the picture. But are there like key things that we look for that are a more narrow bunch that people need to pay attention to? And then I would love to hear about the markers you guys are checking for inflammation, which seems like when you look at all the chronic diseases, those are going to be the ones that inflammation becomes a leading indicator of you're doing something from a lifestyle perspective that is just going to shorten the daylights out of your life.
Yeah. So when we're looking at someone's DNA, as I mentioned earlier, there are specific causative SNPs like Huntington's disease. And there are some that give us a lot of information at an individual level, like ApoE, someone's risk for cardiovascular disease and Alzheimer's. But in general, we're looking at what's called polygenic risk scores, kind of a basket of genetics. Diet is a perfect example. Mike, my co-founder, and I, when we first sequenced our DNA, we saw that we had very different SNPs when it comes to food. I do really well with a ketogenic diet. He has a lot of SNPs that make him very sensitive to saturated fats. And sure enough, when he would try to do a very animal fat heavy diet and a ketogenic diet, he felt like crap and his numbers looked horrible. He would get inflammation from that, whereas I could eat animal fats all day and did really well. And that was a big aha moment for us. It was a big moment because we realized up to that point, I hesitated to talk about nutrition in a group. I would do it with individual patients, but it felt like these religious wars against keto, vegetarian, vegan, and I didn't want to participate. And when I saw this in our genetics, I thought, this is why it's a religious war. People try all the diets, they find the one that's perfect for them, and they assume it works for everybody because they're a human. These other people are human, and so they proselytize and say this is the best diet. And so I just got it. But it also made me realize that there's so much we didn't know about things like this. And all the other things, exercise, how you sleep, all of these things are very personalized. So we look at those with exercise, for example. There are certain SNPs that mean you're gonna respond better to more endurance versus more strength work. Now, this isn't a massive difference, but for example, if you're lifting, we may have someone do a 5x5 routine, or someone else do a 3x10 routine for strength based on whether they respond better to endurance or strength. If you want to get stronger, you got to lift heavy things, period. But how you do it affects recovery. At the time when we first sequenced our DNA, I was doing Ironman racing. I would get injured quite a bit, and I saw that I need more recovery. I also saw I had a collagen 5A1 SNP that means I need more collagen protein. So I started giving myself more rest, more collagen protein, sardines, bone broth, and I no longer had those issues with my tendons and ligaments. So it's a multifactorial thing with everything we talk about: food, exercise, sleep, and everything else.
All right, there is a near impossible level of complexity in the human body already, and then you throw all of this into the mix. Now, let's make it even more complicated. I have to imagine that while obviously your genetics are going to play a factor, your microbiome is also going to play a huge factor. What do you guys do in terms of testing for the microbiome and knowing, so at least my genetics are set, but the microbiome can change by the day. So how are you guys making sense of the microbiome in all of this?
So I'll be completely honest with you, we're not very well. The microbiome is one of those areas where we know it's critical. What we do with it, we don't know. So we will measure it and take it into our data set. And if someone has decreased diversity or things like that, we'll talk to them about what to do to vary their diet and what kind of prebiotics to eat naturally. But to look at specific components of the microbiome and know directionally exactly what to do, we're just not there yet. When we look at someone's DNA, blood work, just questionnaires, we always find things that we can improve and do better on. Microbiome, it's like the depths of the ocean. We know there's extremely interesting things there. We just don't know what to do with it yet. I think we're going to in the near future, and we're collecting all of that data. And now that we're using really AI to synthesize and look at all this and make recommendations, we're also, as our data sets get bigger, hopefully be able to say, hey, with this microbiome and these genetics and this blood work, we should do this. But the microbiome, I think most people who are prescribing things based on microbiome tests, I don't completely trust them. I think they're usually trying to sell a supplement or something else related to it because the data on what to do is just not there well enough, in my opinion.
Interesting. Okay, so talk to me about, when I think about AI, when I think about genetics, when I think about the microbiome. All of this is ultimately a game of pattern recognition. That's what makes AI so powerful. And for people that aren't familiar with how AI works, basically AI is just looking at just an unimaginably large data set. It's extracting patterns, and its ability to extract those patterns seems almost like a form of magic, but in reality, it's just detecting patterns. And when you guys are deploying AI, are you guys telling, obviously in a reinforcement way, so the AI is finding the pattern and then you guys reinforce it? Are you doing human reinforcement learning on what the AI is kicking off, or are you guys just partnering with an AI company that's dealing with that?
Yeah, great question. So I'm going to back up just a little bit. The pattern recognition, you're dead on. And that's what physicians do with their brain kind of before using the AI and something else to crunch the data. And when we first started, we would see and learn things and know these patterns. And so you take my mother, for example, we looked at all of her data. And then as I'm working on the perfect diet for her, she has a VDR SNP, so she probably needs more vitamin D. But then what is her vitamin D level? And then is she in Kentucky in the winter or Florida in the summer? And so the environment, all of that plays in. And then I would make a recommendation. Should she just eat more shiitake mushrooms and organ meats for vitamin D, or does she need a supplement? So we were doing all of that in the human brain, and there's some pattern recognition as well. That's with one very simple and specific thing. There's a lot of factors. When we start looking at these polygenic risk scores, it becomes impossible. And what we realized very early on is it would take Mike and I 10 hours to look through someone's DNA, blood work, questionnaires, all of this, meet them, and then make recommendations and make a plan. And even then, the 10 hours, we knew that we shouldn't be crunching the data with our brain. We should be translating and interpreting for the patient. So that's when we started building the AI about 5 years ago. So we hired the lady who started the data informatics program for a big payer, a lot of other software engineers. And then about a little over a year and a half ago, we were acquired by a publicly traded AI company. And since then, we've added a lot more generative AI building on top of large language models. Yep.
You were acquired by an AI company?
Correct. About a year and a half ago.
That is super interesting. Wow. Okay. Very shrewd play, both by you for using a strategic acquirer. Okay. So now my business brain can help it kick in. Did you guys retain any ownership in the company?
So it was a 100% acquisition. We were a wholly owned subsidiary of that AI company. And the reason for this, we weren't looking for anything. We were doing well on our own, bootstrapping. It's myself and other physicians and engineers. We were approached by them because they wanted to deploy their AI into healthcare. And when they looked around, they felt like we had the best science and the best outcomes. Really, it's our outcomes that I'm most proud of. And they spent millions of dollars on due diligence and had a lot of people dig into what we were doing and decided that we were the best fit. So it was about 2 years ago they approached us. They acquired us about a year and a half ago. And since then, we were at first we were a little resistant. We were doing fine on our own, but the thought of being able to deploy real AI, not what we could build with 20 engineers, was very exciting to us.
Yeah, I have to say, man, that answer has really changed my perception of what you guys are going to be capable of. So we deploy AI here. I have no idea how much you know about what we do, but so we're a media company and we're building video games and things like that. So we interact with AI quite a bit. And the difference between using what is commercially available and working with people that really know what they're doing and are building a hyper customized model is going to be night and day different. Because I hear people in the health space use AI a bit more as a buzzword, but not understanding the true depths of complexity or how just unbelievably complicated. 700,000 SNPs alone is just pandemonium. And then when you put it in with all the other things, you're saying that that's only 20% of the game. It gets very difficult very fast. That's super intriguing. I'm very interested. This is, I think, something that people are going to see happening more and more is if we want to make advancements in health, like real advancements, that there's no way to do it without AI. What are, I'm going to imagine there's a lot of things that you guys aren't ready or willing to talk about yet, but give us a little taste of the direction you guys are trying to push the AI in that you think is like a core part of performance?
Yeah. So this company that acquired us, when they kind of made the offer and things, they were named the most innovative AI company in the world by Fast Company. In that year, I think OpenAI was number 3 on the list. So this is a real legitimate company. They also have strategic partnerships with Microsoft, OpenAI. So we had access to a lot of the ChatGPT, the different versions before other people. And when they first made the acquisition, we weren't in the ChatGPT world yet. And so we were just applying AI to kind of big data. As the large language models have matured, it's become much more exciting. So what we've wanted to do for the last 5 years, we can actually do now. And what we do, I'll be very specific. So we made a model for this. We haven't released it into the wild yet. I'm going to talk about it, whether I'm supposed to or not. But like, for example, we took my data. We put all of the DNA, all of the blood work. And before we were using AI just to give kind of recommendations. It was more like an algorithm engine. This equals that as a recommendation. So still great. But when we took all of that and layered all of my data into an LLM, now I can do things like interact with the LLM and say, hey, what should I have for dinner tonight? And it looks at all of my, and it may say, look, you have a FADS2 polymorphism. That means you need more omega-3. Your last blood test, you're a little low in omega-3. You should probably have some salmon, but you also have this collagen SNP, so maybe sardines would be even better. It can tell me actual foods and eat some cruciferous vegetables because of your heat shock protein genetics, specific foods. Then I can say, just like I could with ChatGPT, yeah, give me a simple recipe and give me a shopping list. And it does that. And then when it flags the omega-3, that reminds me, I said, what was my last omega-3? Should I be taking a supplement? What do you think is the best supplement? I can have this conversation, and it's like having a conversation with a physician, but a physician that has memorized all 700,000 of these SNPs, all of your blood work, all of your history, everything that you've given it. And it's incredibly powerful. Like, to play around with it and ask it about my risk factors for the future is amazing. Now, right now, the way we're using it is as a tool for our health coaches and physicians. Let them dive into someone's data and extract information in large language model way. We haven't released that directly to people. We're going to, but there's guardrails that need to be on it. We need to make sure there's so much regulation that goes along with that about the model can't be practicing medicine. So the recommendations it gives has to have guardrails. We need to make sure it's not hallucinating and all the other problems that can happen with these large language models. But when I've played with it, it's incredible. It is a complete game changer in medicine. Powerful now as a tool for the providers, but going to be even better when we can pull the provider. The rate limiting step is the provider. I mean, you have brilliant physicians, but you don't have access to them at 2 a.m. if you have a question, or they may be seeing another patient. So to be able to extract them from a lot of this, at first, it's just making them more powerful. But eventually, very soon, I mean, we already have it. We just aren't comfortable releasing it yet. It's going to be a real game changer.
Man, this is really exciting. As somebody that's obsessed with the idea of living forever, and if not forever, at least for a very long time at high performance, I didn't realize AI was insinuating itself so deeply into the health space yet. I knew it would eventually, but I didn't realize that companies were already moving so swiftly. That's incredibly encouraging. So imagine, for anybody listening to this, imagine if you had Siri or Alexa, but Alexa knew everything about you, knew your workouts, knew your genetics, knew your microbiome, which AI will be able to deal with that level of complexity over time, knew what you ordered, knew where your vegetables came from, like all of it, and was able to assimilate that into, like you said, you can ask it, okay, given everything you know about me and what I did today, and I was stressed out because I got in an argument with my wife this morning, et cetera, et cetera. It's like, oh, here's a simple meal based on things I know you have in your refrigerator, and eat it, and you will feel so much better. That's really crazy. That's super exciting.
Yeah,
Talk to me about the outcomes. Go ahead.
I was just going to say, my view on it is that AI, the real place, I mean, it's going to take over everything, but healthcare and education are the two places that are extremely ripe right now for it to really have a massive impact. And there are AIs specific to healthcare, like MedPalm 2 is Google's version. And these AIs have been shown to perform better than doctors at answering basic questions. They've also been shown to be more compassionate when interacting via text with patients. But as you mentioned, the real power is the personalization. getting all of that data and feeding it that data, not just knowing all the right answers to medical questions and how to interact with someone, with the patient, but giving all that personalized data. That's where the real power is.
No, man, this is insane. Okay, so talk to me about your guys' outcomes. Clearly doing something different than most people, going a lot deeper. What are the outcomes?
And these outcomes came before really the really powerful large language models, but they're still a step of anything that I've seen. So you mentioned glucose and hemoglobin A1C. In traditional medicine, when someone has diabetes, we can quote unquote cure it, kind of normalize their A1C about 3% of the time that happens. In our patients, 47.5% of our patients who have prediabetes or diabetes have complete resolution of their A1C. So taking their A1C back to normal, so normalizing their metabolic health. That alone is a massive game changer for patients' health. We've seen similar things. You mentioned inflammation. So we see about a 69% reduction in CRP for those that are at risk and already have an elevated CRP. 64% normalization of insulin resistance, which really reduces their chances of everything. LDL cholesterol, 58% reduction in that, which is better than a statin. And this is with lifestyle interventions, just teaching someone that, hey, these foods are kryptonite for you. You have an SH2B3 polymorphism, so quit with the gluten and wheat. You have an MCM6, so quit with the dairy. You have these SNPs, so eat these superfoods. So food, nutrition, sleep, exercise, these lifestyle factors, we've had these really incredible results with.
Man, this is really a glimpse into the future of how this is going to work. My wife went through an absolutely debilitating gut issue, and it would have been really fascinating as in the early days, before it became a truly just devastatingly acute problem, if she could have looked at her genetic readout and said, oh, okay, I get it. I need to limit dairy, or, oh, I get it. I need to limit my wheat intake, so that it didn't become ultra problematic. Now, we have always attributed everything that she went through to the microbiome. I'll be very interested to see over time if that plays out, or if it was that we could have been paying attention to something genetic earlier, that she had a predisposition to have a hard time with something, or, because I'm with you, I think diet advice really has to be given at the individual level. But I can't ever help myself from at least telling people, hey, here are the things that I think come closest to being universal fits. But I'm only doing that because I can't get like, hey, go look at your panel and see like where the things are that break down for you. But for people to have a truly individualized plan and to know what they should avoid, because I'm going to guess, again, going back to universals, there's almost certainly something that all of us should be limiting our intake on. And to know what those things are early is going to have a massive impact, especially when you think about the big killers like cancer and heart disease, dementia on the rise, that these are almost all certainly diet and lifestyle related. So being able to get these outputs is pretty thrilling.
Yeah, and thinking about your wife, I don't know her entire journey, but I know what traditional medicine normally is like, and it's a lot of trial and error. When someone has a problem, we may say, okay, a lot of people have problems with gluten, so cut that out and let's see what happens. And then a lot of people have problems with this, cut it out. And the person making that hypothesis, which is really a guess, has data. They're using data, talking to your blood tests, but the more data they have, the better they can actually shortcut the trial and error and get to the actual root problem. We still have to try things out. We still have hypotheses, but our hypotheses are just much better because we have so much more data on someone before we start making those guesses and trying things.
Okay, so because I am just an absolute techno-obsessed person, I want to now look at your company as like this AI, computer-driven, servers everywhere. But I know one of your core values is to live wild. How, like in a modern context, when we are in cities and we're using AI and we have devices in our pockets and all of that, and yet, despite all that knowledge, health is declining, what is the importance of rewilding ourselves?
Yeah, we think that our disconnection from nature is a big part of a lot of our problems, and I see the irony in kind of solving a lot of this with technology. But we do think that time in nature makes a big difference. They've done really cool studies, Tom, on people in hospital with gallbladder surgery, for example. They take their gallbladder out, and then they randomize those to two different groups: one that had a window looking out at trees, and one that had no windows. And the ones looking at trees got better more quickly. There's an incredible amount of data out of Japan on forest bathing and spending time in nature, and they decrease rates of heart attack, cancer, so many other things. And so while we do take a very AI-driven approach, data first approach, part of that data is the fact that we know people do better when they're outside and in nature. So we are encouraging people to get out more. This technology can allow for that as well. Like we don't, like the amount of time, I mean, someone can now access this while they're outside and in a park or somewhere else. Because we're delivering this medicine remotely and via telemedicine anywhere as well. So it's not done in a clinic where you're under fluorescent lights.
Now, do you, and I know this will be a guess, but so you had Florence Nightingale that realized, I think she was World War I, that if you put a patient outside where they could actually get sun, that their wounds would heal faster. So vitamin D probably isn't the only thing that sun hitting your skin is going to do, but that's an easy one to round it to. But you're talking about people just looking out the window at a tree. Now, do you think that it's that they're getting sunlight through the window and it's the window, not the tree? Or is this really a subconscious or maybe more primal connection? Like, I don't understand why seeing a tree, like if we ran that same experiment and it's a big TV screen or LED panels, but I'm showing you trees, would it work? I know this is a guess, but I'm very curious what you think is going on. Is this spiritual, or is there a mechanism of action that has to do with actual molecules?
So the cool thing about this exposure to nature and its effect on wellness is dose dependent. So, for example, in some of the Japanese literature, just terpenes from like a pine forest have a positive impact on people's cortisol levels, stress levels, blood pressure, things like that. Terpenes? So it's a molecule you smell. So when we think about our senses in general, we were talking about looking out the window, which made me think of this in the sunlight. So the sunlight on our skin, sure, vitamin D, we know that has a positive effect. Those terpenes we've seen have a positive effect. But I also think just looking out the window, just the psychological effects. So in another sense, touch. If someone is holding someone's hand and they do a painful procedure to them, they feel less pain if they're holding someone's hand who they love versus a stranger's hand. So the psychological component there to pain, I think, is a similar thing when you're looking out a window at nature. Just seeing it does something to your physiology, maybe your stress hormones, your cortisol, that makes your body just work better, maybe be more parasympathetic and able to heal up more quickly. So it's a multifactorial thing. So then to answer your question, would they do better just seeing a TV screen of it? Probably a little bit better, but the window would be even more. And then when they looked at people being exposed to just walking outside versus being in the woods versus being in the woods for a week, the benefits seem to increase with the intensity of exposure. It's a dose-dependent curve.
That's really interesting. How do you guys integrate all of this into your approach?
So that part itself is just about education and teaching the patient. So I think a big part of what we do as clinicians is education. I'm never here to tell someone what to do. I'm here to give them as much information as I can about themselves and about what I know when it comes to the literature. So that is just kind of woven into all of the recommendations. If we're talking to someone about how they're going to exercise, we may help them brainstorm on how they're going to do it more outside, just to stack that benefit. So it's woven all throughout. And that's where the health coaches really come in. So every patient that we see has all the AI stuff, but they also get a doctor and they get a health coach. The health coach is there more to motivate and also to translate and continue to give them ideas on how to stack the things, because the amount of information we give to a patient is tremendous. So they really need guides as they go through the process.
And what do you guys do in terms of updating the blood panels and things like that? How frequently should people be testing, be looking at this stuff? Is a once-year visit enough? Or there's things like, I really enjoy wearing a continuous glucose monitor. I don't do it all the time, but I probably spend at least 4 months a year with a glucose monitor on my arm. How much do you encourage people to track, and how often do you want to see them update their panels?
So as with every intro I give you, is personalized and it depends, but let me give you some examples. The DNA, we don't update. We do that once, obviously. Blood work, it depends on which blood markers. If we see your inflammation is up and your CRP is elevated, for example, we may check that again really soon, because it could have been an acute thing, like you had a mild illness or you just had a really hard workout the day before, and that changes very quickly. Hemoglobin A1C is a measure of your glucose over 3 months. So we're not going to check that very often because it's not going to change. So it depends on the measure, and it depends on our goals and how quickly we think we can see change. So it's a very personalized thing. On average, I would say people get new labs every quarter or every 6 months. If they're doing great, no issues, maybe once a year, but it's usually more frequent than that. And to your point, we're looking at things daily when it comes to sleep, CGMs that people would wear, other wearable devices. The AI, this is a kind of a future state that we haven't released yet, but you can imagine really cool things even with, we're able to intake everything that Apple Health and Google Health pull from. So your Oura Ring, your Whoop, your Fitbit, your Apple Watch, all of that. And so we can actually, we can be proactive and say to someone, hey, your HRV was elevated this morning. Your sleep looks like it's okay. Your exercise hasn't been too intense, like you're overtraining. So you may be getting sick. Or did you have a lot of alcohol last night and we don't know? Did you have friends in last night? Do you have something stressful going on at work? If you didn't have alcohol, stress, these things, you probably should talk to your health coach and doctor because you're probably getting sick with this elevated heart rate or decreased HRV that it sees. So we're measuring daily and to the minute to some things, and then blood work is more kind of quarterly to yearly, depending on the issues you have going on.
Okay, one of the things I found really compelling about what you guys are doing is you work with very high level athletes and have helped some number of them have really the best year of their career. What is it about the system that you guys have that allows people, even at that elite level, to eke out, a 0.5% or 2% more performance, which at that level is insane?
Yeah, it's all of it. So I'd give you an example of that. At an NBA player that we saw, this is a max contract player, and the initial issue, he's playing great, but the initial issue was mood, just kind of some depression, anxiety throughout the season. And when we dug in, there's a very specific combination of things. So he had an Adora 2 SNP that made him more sensitive, his sleep more sensitive to caffeine. He also was a slow metabolizer of caffeine, yet he was doing the same thing that all his teammates were doing, which for decades we've been taught that caffeine is an ergogenic aid. It makes you perform better. It turns out it makes you perform better if you're a fast metabolizer, no effect if you're a moderate, and it hurts your performance if you're a slow metabolizer. But the studies say it improved for 80% of people, so it just says positive. What's positive for some people, not others. So we teased it out in him. He would crush kind of these energy drinks and things before a game. The games are late. His clock genes, when it came to his genetics, he needed to be going to bed earlier, but he was going to bed late with everyone else. The sleep was destroyed because of the caffeine. Then he would wake up late just in time for shoot around, have to sleep again, get in this horrible cycle that really was sending him into depression. And so just seeing all of those factors and fixing that, just getting his mood better and his mind right, made a massive improvement. Getting his sleep right. There are studies out of Stanford where they looked at college players. Their free throw percentage, 3-point percentage each went up by like 8% relative to where they were. Their sprint times, when you just improve their sleep as well, randomized them to that. So it's different for everyone. But when you optimize the entire system, like trainers and coaches aren't looking at something like sleep and mindfulness very often. So sometimes we find things with the genetics, blood work. This player particularly, I remember, also had a VDR SNP and low vitamin D, which is very common in African-American people, more so than Caucasian, low vitamin D. And that has an effect on your hormones because it's a precursor hormone and on muscular contraction and strength. So fixing all the parts of the system is where we really get the benefit.
Man, this is amazing. Matt, thank you so much for taking the time to talk with me, and super excited to be working with you guys. What do you want somebody listening to this to do next?
I truly believe that this is how medicine should be practiced. Like, I think there's so many great physicians out there, but if they don't have access to the data and can't translate it for you, you're not getting the care that you deserve. If anyone is interested in actually becoming a patient, wildhealth.com, we have a few different programs. Those pro athletes and executives, we have a really extensive program where we go super deep on things like full body MRI, coronary CTA scans, DEXA scans, VO2 max, all of that. But for most of us who don't need that level, we also have a standard plan as well. This the genetics, blood work, and then whatever else you need on top. So I would encourage people to talk to your physician about this. Like, some physicians are trained well in this and are going to do a great job. If you want to see someone who does have access to this tool, then come to wildhealth.com if you are a physician and you're interested. So one of the things very early on, Tom, we realized we needed technology and AI to crunch this data. We also needed more providers that were trained in it. So we developed a 12-month fellowship program. We've taken hundreds of providers through that. So if someone's interested in being a health coach or a doctor and learning it, we have a fellowship program as well.
It's incredible. All right, boys and girls, if you're anything like me, you're going to try this out because I want to know my SNPs, if nothing else. This is really an exciting time to be alive. I'm super excited by what you guys are doing, and I will be watching very closely as you roll out some of these new things as well. But super excited. All right, everybody. Until next time, my friends, be legendary. Take care. Peace.
Hey, everybody, a quick note about our precision medicine training program. It's been a really popular course. We're constantly hiring health coaches and physicians, but we're only hiring them as we grow if they're trained in precision medicine. You don't get that in medical school or other places. And so we've developed this training program, and we've completely revamped it recently. It's a lot more robust. So now there's still over 50 hours of live synchronous training. There's also all the asynchronous credit, over 50 hours of content. And as a physician, you get about 50 hours of AMA Category 1 CME credit, which is a nice benefit. For the health coaches going through the training program, it's now accredited by the National Board of Health and Wellness Coaching. So graduates are going to meet the requirement to sit for the board exam and become board certified health coaches. So there's a lot of benefits to that, not just the certification, but also when it comes to things like insurance reimbursement. So it's a really robust program. If you're a physician, a nurse practitioner, a PA, or someone that just wants to be a health coach, it's open to all of those categories. There's the 6-month program that's kind of the full program. And then we also have just a fundamentals of precision medicine course, which is completely on your own. It's online. It's all asynchronous. You still get the 50 hours of AMA Category 1, but it's self-paced, and you still have access to the online community, but not all the synchronous lectures as well. So if you're interested in checking that out, go to wildhealth.com/education, and we'd love to have you as part of our next class.